The landscape of healthcare privacy in the United States is a complex web of federal regulations designed to protect patients' personal health information, PHI, while facilitating the flow of data necessary for providing high-quality healthcare services and promoting public health. The cornerstone of this regulatory environment is the Health Insurance Portability and Accountability Act of 1996, HIPAA, which has been supplemented and updated by subsequent legislation such as the Health Information Technology for Economic and Clinical Health, HITECH Act of 2009, and the 21st Century Cures Act of 2016. Additionally, specific regulations like the Confidentiality of Substance Use Disorder, Patient Records Rule, 42 CFR Part 2, address particular areas of concern within the broader context of patient privacy. HIPAA Privacy Rule. The HIPAA Privacy Rule establishes national standards for the protection of individuals' medical records and other personal health information. It applies to 3 types of entities: health plans, healthcare clearinghouses, and healthcare providers that conduct certain transactions electronically. The rule requires appropriate safeguards to protect the privacy of personal health information and sets limits and conditions on the uses and disclosures that may be made of such information without patient authorization. It also gives patients rights over their health information, including rights to examine and obtain a copy of their health records and to request corrections. HIPAA Security Rule. Complementing the Privacy Rule, the HIPAA Security Rule sets standards for protecting the confidentiality, integrity, and availability of electronic protected health information, EPI. It requires covered entities and their business associates to implement physical, administrative, and technical safeguards to secure EPI. These safeguards include access controls, audit controls, integrity controls, and transmission security measures to ensure that EPI is not improperly altered or destroyed and is accessible only by authorized individuals. Use of online tracking technologies by HIPAA, covered entities, and business associates. The advent of online tracking technologies poses new challenges to the HIPAA framework. Covered entities and their business associates increasingly use these technologies for various purposes, including marketing, patient engagement, and operational efficiency. While HIPAA does not explicitly address online tracking, it requires that any use of EPI, including through online tracking, must comply with its privacy and security rules. This means ensuring that any collection, use, or disclosure of PHI through online tracking is adequately protected and authorized under HIPAA, Health Information Technology for Economic and Clinical Health, HITECH Act of 2009. The HITECH Act represents a significant expansion of HIPAA rules, particularly in the areas of privacy and security. It introduced stricter penalties for HIPAA violations, expanded the scope of privacy and security protections to business associates of covered entities, and increased the legal liability for non-compliance. The Act also provided for significant investment in health information technology and incentivized the adoption of electronic health record (EHR) systems by healthcare providers. One of its key goals was to enhance the use of EHRs, while ensuring the privacy and security of patient information through updated regulations and standards. The 21st Century Cures Act of 2016. The 21st Century Cures Act further advanced the regulatory framework governing health information privacy by promoting interoperability and prohibiting information blocking. The Act aimed to facilitate the exchange of health information between providers, patients, and other stakeholders to improve healthcare delivery and outcomes. It also sought to enhance innovation and research through more accessible health information while maintaining robust privacy and security protections. The Act addresses the need for modern regulations that keep pace with technological advancements and the evolving healthcare landscape. Confidentiality of Substance Use Disorder, Patient Records Rule, 42 CFR Part 2. This rule provides stringent protections for the confidentiality of substance use disorder, SUD, patient records. It prohibits the disclosure of any information identifying an individual as having or having had a SUD unless the individual provides written consent. The disclosure is allowed by a court order, or the disclosure is made to medical personnel in a medical emergency. The rule reflects the sensitive nature of SUD treatment records and the potential harm that inappropriate disclosure could cause to individuals seeking or receiving treatment. Conclusion: the U.S. healthcare privacy regulatory environment is a dynamic and evolving field shaped by legislative and technological changes. Laws and regulations like HIPAA, the HITECH Act, the 21st Century Cures Act, and the Confidentiality of Substance Use Disorder Patient Records Rule form a robust framework for protecting patient privacy. However, as technology advances and the healthcare industry becomes increasingly digital, ongoing efforts are required to ensure that regulations keep pace with innovation. The challenge lies in balancing the protection of individual privacy with the need for free flow of information to improve healthcare outcomes, a task that will continue to require careful consideration and adaptation by policymakers, healthcare providers, and other stakeholders in the healthcare ecosystem.